Good afternoon, everybody. Today is December 4th, 2020. This is Scott McGann with the Falmouth Health Department doing our weekly COVID update. Our email is falmouthmass.us. Our website is falmouthmass.us. Our email is health@falmouthma.gov. Our phone number is 508-495-7485. So we have not had a good last couple of weeks. Neither has the Cape or Massachusetts or the Northeast in general. As of yet, the cases late last night, early this morning, we had 436 cases of COVID. Since the beginning of March, March 19th, when we had our first test, the first positive. There's been 95 confirmed cases during the period of November 20th to December 3rd. Approximately 75% of total cases are no longer in isolation. Obviously, we've had a lot of cases recently, so they're not going to be out of isolation. To show you how the Cape is not faring as well as it's been, normally, when we do this, we're about 14% of the population, and roughly we get about 14% of the cases. We were, last time I did the presentation, because it was Thanksgiving last week, that we were right at 14. We've dropped to 11.7 of all cases because other towns have had it, sort of even worse than we had. The VNA and the CTC, along with the health department, keep doing the contact tracing, and I'll mention some more further down. So we've had our fair share of cases. If you look at our weekly case trend, you can see from, again, May to sometime in early November, we were less than 10 a week, and then we started to trickle up between the 10 and 20 for a few weeks. And now we're right around 30 or so cases per week. We do have a long-term care center with 30-plus cases, which is represented in the very high week that we've had. Started late last week into early this week. If that didn't happen, then we'd be, if you look at sort of the general population, people that are out and they're not in congregate living, that we've been in that 28, 33 range, somewhere in there over the last couple of weeks, which is 6 times or 7 times more than what we were having previously. So we're definitely having our share of cases, and it's being reflected in this. Now you can look at the curve. You can see the sharp incline at the end of the last few weeks. Again, we talked a lot earlier on about flattening the curve, which we had done when the state had done earlier, basically around from about June, late May, early June, all the way till early to mid-September, but that's not the case anymore. And Falmouth is indicative of what's going on elsewhere. Not quite as bad, and we'll show you in a slide before, but still not where we want to be. Before I show you the next slide, again, for Falmouth, to be in the green, you have to have less than 43 cases under the new metric, or greater than 43 cases, or 5% positivity, you go yellow. And if you got both, 5% positivity rate based on the number of tests that you've had and that rate, and over 43, we would end up in the red. So for the first time, we are in the yellow. We've done really good of staying out of the yellow. We're one of the few towns that have been able to stay out of the yellow, but you can see from 10-1 all the way to 12-3, an increase. We were doing well in that, 7 cases a week, 15 over 2 weeks, and all the way up until about Halloween. And then we started to tick up a bit around, into that a bit more, 10, 11, 12, 13 a week. Over the last couple of weeks, we've definitely had a market increase. Percent positivity has gone up as well. Again, less than 1 is wonderful. Anything over 2 is not good. 2 is, we start getting over 2, you're really going to have community spread because it goes up very, very quickly. So 50 cases could be 100 really quick, as opposed to going from 4 to 8. So it's a number that we need to drive back down. Barnstable County as on the whole is about 18.5 out of 100,000, where it's just roughly the same at 17.9. Their percent positivity is about 1% higher for the entire county at 3.43. We are still doing a great job with testing over that 2-week frame. Remember, these are 2 previous weeks, so this is the week of, this would have ended at the end of last week. So 30,738 tests, or roughly around 1850 or so per week, which is great. That's a lot of tests. It's good. And but our positivity is being reflected. And part of that number being higher, of course, is some of this numbers does count some of the long-term care cases that we've had in one long-term care facility. Barnstable County's daily numbers, you can see, are up. No doubt about it. Somewhere in that 70s. They had one really bad day, but been mainly around that 80 plus or minus most days per counts on the Cape. This is taking all the towns, including Falmouth. So the Falmouth numbers here would be the same that you saw a couple slides ago. You can see that town of Barnstable over the same 14-day span had 359 cases. Yarmouth had 102. Mashpee had 37. So you see a lot of yellows. You see towns that are still holding their own. Over Sandwich had a lower one, and the Outer Cape has been doing well. And so you see that all the trends are higher, especially in sort of Barnstable, Yarmouth area and Harwich, and you're seeing it here in Falmouth. Edgartown as well had a lot of cases, for a third of their cases almost. Well, actually, yeah, a third of their cases over the last 14 days. So all this data shows that we do have community spread. It has been increasing, and we need to start. Individuals need to start taking accountability for what they're doing. If you're outside now and driving around, there's plenty of cars out there, and we're kind of semi-normal. We're wearing masks and socially distanced, but we're out doing stuff. And now it's the time to start thinking about what we were doing earlier on in the summer to help this to keep the numbers down. So I think it's time to start thinking about not making extra trips and some of the activities that we all might be doing. Because the number of cases are out there, so there are more people out there with it, and therefore it has more of a tendency, obviously, to spread. The state's numbers, this is the highest number I've seen in a while. They had out of 111,000 tests, they had 6,477 positives for yesterday. This is yesterday's data. This is updated around 5 o'clock every day. The 7-day positivity is awful. It's 5.29. Once that number starts hitting these types of numbers, it's going to grow fast. The 2,000 to 3,000 that we were seeing all of a sudden become 6. And if it goes unchecked, it'll easily be 10 or 12 within the next 10 to 14 days. That'll happen quick. There's about 50,000 active cases. There was 49 deaths. Of course, when the cases go up, the hospitalizations go up. It's not going up quite as bad, because if you look to the right-hand column, you see that most of our cases are still, like I said the last time, below the age of 50, whereas the 70 to 80-plus-year-olds, where the death rate would be much higher among that age groups, are still on the lower side. So you're seeing, even though hospitalizations are up, don't seem to be up at the same proportion that the cases are up. Average age of hospitalization 68, average age of deaths is 81. That's been pretty consistent since earlier in the summer. Average turnaround for a test is about 2 days. If you are being tested, you're symptomatic and you're getting a test, or you're getting a test for some reason, like that, and you're symptomatic, you really should be quarantining yourself prior to the results, not floating around waiting and then doing what you're going to do, waiting for your results, and then be surprised when you're positive, and then you just expose some people. And we've actually had that happen over the last week, so we don't want to see people doing that. If you're being tested, obviously, as a healthcare worker, and it's just a routine, that's not necessarily, we're not asking you to stay home all the time for that, but that's if you're symptomatic or you're being tested because you were a contact or you're symptomatic, then you really, really need to take it seriously. This rainbow graph shows that the red and the yellow is the above 70 years old, and we've done a good job since early summer, late spring, early summer, of keeping that population protected better than we had been previously. All these metrics show you the average daily cases, the positivity rate, the hospitalizations, and the deaths are all up. Now, cases are up a lot higher than the deaths are in terms of percentage. So up 1,294%, but only 197% in deaths, and about half that in hospitalization. So even though those are up, they're not up at the same rate, because, again, the age group of the people that are getting it are generally younger and healthier, and fight this better. Again, since March, you can see that that peak's exceeded that. Even though that early peak, I had done it in my previous, a couple weeks ago when I did the last presentation, that number is artificially low because of the number of tests that we had available. We have a lot more tests available. We're testing a lot more people, finding a lot more. So it doesn't surprise me that this side of the column, the right-hand side, is showing that there's more cases. Okay, so per 100,000 people in the state, about an average of 36 people in the last 14 days out of 100,000. Positivity rates are not in a great direction. It comes out to 5.29, which is the dark blue, but in the light blue being higher education testing, the routine testing at colleges, if you take out that, you would actually be at 7.32, which is a terrible number. And that number is increasing, very, very quickly, as are the cases, and that's sort of what we need to, as statewide, need to take care of this at some, hopefully soon. Hospitalizations, again, are up 700 from earlier in the month, the 12th. You can see that normal days that we're adding, having an increase of, 93, 68, 65. So, the hospitalizations, the ICU is up 80, and the intubated is up 69. Hospitals know what to do a little bit better, keeping people prone during their hospital stay helps, and there's other things that does help, and some of the medications are, some of the newer medications are working their way to us. And so I think, we're doing a little, not quite the same as far as the intensity of some of the cases, but enough to warrant the hospitals to consider start going into their spring modes with setting up the tents and the outdoor sites. I believe the hospitals are either going to be doing that or shortly. I've heard that secondhand, not directly from them, but they're going to be either constructing that or shortly. Hospitalizations, again, the hospitalizations were a lot higher earlier on, and hospitalizations, deaths are definitely a delay, but hospitalizations would happen within a couple of weeks of the increase, a week or two of the increase. We're not seeing it quite at the same rate, again, mainly because of younger kids and just doing better, a little bit better with the long-term care facilities and so forth. Speaking of long-term care, we did have an increase in one of the long-term care facilities, the Atria, this week, which accounted for a fair percentage, 40% or so of the cases that we've had. It's been a good few days for them, and so they have their procedures. They work directly with an epidemiologist at the state to take care of that. So the case counts have gone up by about 1,200 over a 2-week span, the 19th to the 3rd. And deaths have been up about almost 200, 202. No, reverse that, right around 200. So we're, the long-term care didn't get hit as early as before. We did see, we've had a really good run with our long-term care. We haven't had an issue. We had one issue this right around July at the Royal McGann, which became mostly asymptomatic, which was great. Other than that, we've done really well since about June-ish, late May, early June, and now we've had cases or two, multiple cases rather. So again, working with the state works closely with the Atria on this, and they put an epidemiologist, and also our VNA does working with that as well. The deaths are not listed anymore, so no longer reported. I've just added an acronym there, NLR. They're not really reporting that, so I've taken that off because of that's not being reported to state. At least the form I looked at. I might have to find some other source. Okay, as far as COVID testing, there's some good news about testing. Testing continues at the Falmouth Hospital. Same thing, your physician would call to set up an appointment. Also available at your pharmacies, Falmouth CVS, your walk-in clinics like the Convenient MD, Community Health Center of Cape Cod and Mashpee. They are filling up. They did fill up during the holiday week because people wanted to get tested for travel or tested to go visit. Beginning in a week, about 10 days to 2 weeks, a drive-through testing site is going to be operational at the Barnstable County Fairgrounds. So it's going to be a drive-through. It's operated by the Barnstable County Health and the Environment, so that's the County Health Department, and the Medical Reserve Corps, which is the MRC, which are volunteer nurses. From funds obtained from Dylan Fernandez and Sue Moran, they obtained $300,000, and we're going to use that for a drive-through here at Falmouth. If someone is interested in being a volunteer with the Medical Reserve Corps, especially nurses is what we're looking for, you could contact Diana Gammond. Her number is there at 375-6641, or give her an email. You can find that email if you lose it from this video at the Barnstable County's website. I'm not quite sure if she's looking, but I thought it was a good thing to put it in the slide, especially as we get further down with vaccines and so forth, that we may need the help. Clinics will be by appointment. They will be taking insurance, so similar to the hospital, okay? But if you don't have it and you can't obtain a doctor's note, the cost for this, not using insurance, will be considerably less than market rate. I think market rate somewhere is around $120 to $140 somewhere at some of the walk-in clinics. This would be, don't quote me on it, but it's somewhere around $60. It'll be just for cost, not looking to profit or anything on it, so it's going to be considerably less. It's going to be run until the funds that was obtained run out, unless we get more funds for it. So it's another avenue for you. It's going to be a PCR test, so there will be that same turnaround. We've been told about a 48-hour will be your average turnaround on this with the lab contract that the county has gotten. So, more details will come. How you're going to be registering for this online. I believe there'll be a phone number if you can't register online. I don't have all those details yet. We just did a walkthrough of the facility up at the fairgrounds. Thanks for the fairgrounds for letting me use the property. And when we do, we talk about vaccines, it might be one of the spots that we could use while we're doing vaccines, because we'll need one that's sort of a standing COVID vaccine. Once we get our hands on some, if we need to be doing mass clinics, then we'll need to have sort of a standing location. We can't just take the high school over for a month or something of that nature. So it might be a place that we could use. We have to look at things like the grounds and make sure it's okay during storms and mud and things like that. So that's one of the possible spots. And, right now we're going to be using it for a drive-through testing site. Again, types of COVID tests, this will be a PCR. Again, the PCR there are delays. It's taking more than 24 hours on average. The state says about 2. I've heard plenty of stories that it's taking a lot more, which makes it frustrating. If you've had a test because you were a contact, again, I said it before, or you're symptomatic, you can't be floating around like normal just waiting for the test results, because the virus doesn't care whether you got a test or not, and it's going to spread. And we've had a couple incidences where that's happened. The antigen tests are being used a lot more. Antigen tests are good. They're rapid. They're just not quite as accurate as PCR, but it does indicate, a current infection. We consider them probable. We contact trace them. But they are rapid and cheap, and so the antigen tests are still good tests. If you do test positive on the antigen, it's a good idea to get a PCR, because your antigen, if you're positive with an antigen, you should be isolating yourself. And, you could get a PCR, go get yourself a PCR. You can isolate yourself while doing that. And you can do that and have 100%. Antibodies, we're not seeing a lot of those anymore. Those indicate a past infection. And DPH doesn't do much with them. They consider them suspect. So I leave this up. Social distancing is important as ever. So it's continued diligence with the social distancing, face coverings, following the guidance, not working. See, a lot of people, when you get this disease and you're 28 or 32, you tend to have mild symptoms. Well, treat those mild symptoms as COVID. I know it's inconvenient, but it seems to be spreading a lot among people that were relatively surprised or mildly enough, symptoms where they didn't think they had it, and that's, a common thing. Quarantining when you're traveling, getting tested if you feel even slightly sick is a good idea. Hand washing, hand sanitizing, gloves, that doesn't change. State guidance needs to be followed. If you're a business and you have your own state guidance, you need to follow it. Don't cut corners on that. I actually have to get rid of that. Last thing we want to do is undo the hard work that we've done. We've essentially kind of done that. It's just sort of come in as a tsunami over the last week or so, and we just need to keep diligence in order to knock it back down. As a recap, state metrics are increasing rapidly, especially once they hit 2%. We're increasing quickly as well. The Cape even more so. We had a long-term cluster occur in Falmouth. A couple of things I'd like to add. I know I'm going a little longer than usual. Please answer the calls from either the VNA, CTC, or the Falmouth Health Department for contact tracing. I just got an email from the VNA. It's the same with the CTC, that it's 3 times harder to get a hold of people than it was early on. People, when everybody was on lockdown, they weren't floating around. They were answering phones better. We're getting, I've heard from the CTC up to, not maybe just specific to Falmouth, but up to a quarter of people are not answering the calls. And you can't contact trace if we can't get a hold of you. And it makes things a lot more difficult. So please bear with us. The health department, what we've done over the last couple of weeks, because the CTC is being overwhelmed, as is the VNA. VNA does contact tracing for a bunch of other towns, and when we go up and they go up, it makes it very difficult. That we've jumped in and we're starting to call. So you might actually get some duplicate. We want to call and get the meat and potatoes. Contact tracing takes a while. There's a lot of questions. It's a 7-page form. The health department wants to know immediately, who your contacts, where you work, some of the real specific things. So you may get doubled called. We're just looking at it and looking at Maven, where the site where all this stuff gets put in, and seeing where the gaps are based on responses. And we're trying to jump in as well at the health department to get better contact tracing. And the other thing I wanted to bring up was get tested even with mild symptoms. It seems, we've got a lot of mild symptoms, and they're turning out to be larger problems because people don't necessarily think they had them. Such as, came down with it on a Friday, People hung out with me on the weekend, it didn't get any better. Started thinking maybe it was COVID, got tested on Tuesday, got my results on Thursday. But you were just around for 6 days doing your normal stuff, and now how many people were exposed? That kind of stuff does happen. So it's easy to get tested. You just need to take it seriously. I know it's inconvenient to isolate yourself, but if you've had a little chills or a little fever or congestion, the chest congestion, loss of taste, smell, especially the taste of smell, because that's pretty much, you got COVID. If it's one of those weird, all of a sudden loss of sense of taste, that's not a normal sense of taste and smell. But you really got to take it seriously and get yourself tested, even if it inconveniences to put you out for a couple of days. I don't think any employer is going to want to force you back in. If they do, give us a call. We don't have to use your name. We'll go down there that day if you're being forced to come in, if you're not an essential worker, because rules are different for first responders and things like that. So everybody stay safe. If you haven't been diligent, this is the time to do it. There is community spread. It's about 30 cases a week. That could easily go to 60 to 90 by the time we're doing this at the beginning of next year or the next 3 or 4 of these. So stay safe, everybody, and we'll see you again next week. Thanks.